Welcome to NCPDP Unscripted, the podcast where healthcare meets real talk. Each episode, we will dive into unscripted conversations with industry leaders, changemakers, and innovators, discussing the challenges, breakthroughs, and behind-the-scenes stories you won't hear anywhere else. Whether you're on your morning commute or taking a break between meetings, settle in because it's time to get unscripted.
Jen, welcome to the NCPDP Unscripted podcast.
Thanks for having me. I'm excited to be here with you guys in Louisville.
Yeah, very exciting. So Joel from Monument was our first guest on our podcast. And
I didn't realize he was the very first
Yes,
one.
he was. So excited to have you join us.
Yes, thank you.
So before we get started, tell the audience who you are and where you work.
Sure. Jennifer Steger. I'm a vice president at Monument Advocacy. I spent 8 years on Capitol Hill before joining the healthcare team and have had the honor and pleasure of working with NCPDP for almost my entire time at Monument with the healthcare team, doing a lot of the advocacy priorities and a lot of the DC meetings and tours.
Yeah, it's been a lot of fun. I know.
It has.
All right. So when we interviewed Joel, we were in the first 100 days of this new administration. So I want to actually start there. I know he talked a lot about kind of executive orders and, the focus of this new administration with access, affordability, technology. Any updates you can share on some of those before we dive into some other topics?
Sure. I think one of Joel's things was that the party kind of never stops, and it really hasn't, even through 2025. I looked up right before this the executive order numbers, and it was there's been 221 executive orders signed by President Trump as of mid-December, and that was more than his entire first term, also more than any other president since Jimmy Carter.
Oh, wow.
So it just kind of goes to show the amount of action and activity across government-wide as to what they're looking to do, and there's there's just a ton of action in healthcare specifically that's translated to there's the MAHA Commission and the list of what I think it was over 100 different initiatives and ideas that they wanted to implement through for Make America Healthy Again. There's the drug pricing, and then you mentioned technology. There's even pediatric cancer and AI, using AI for pediatric cancer cures. So kind of going through the gamut of what does how technology, what they see as kind of the future of healthcare.
That's great. And one thing I've noticed with this administration is they seem to be moving a lot faster, I think, in healthcare technology than we've seen in the past, which has been really interesting. And I think, it's not that the priorities have changed. They just seem to be moving in faster tranches. Is that something you're seeing kind of across the board on your side?
I think we're seeing that a lot in the administration priorities and also in Congress's priorities. They had this huge goal of getting the reconciliation bill passed by July 4th, and that was a goal they were able to meet, which I think probably when you talk to Joel, that probably was not what we thought at that point. And they're, in the first 100 days, a lot of what we were seeing was directional and kind of aspirational, and now that's switched to implementation and what the actual policies that are going to implement those visions look like.
Yeah, great. Excellent. So we've been seeing a lot coming out of CMS. So new payment models, this whole health tech ecosystem that they've announced, where they're kind of talking about rolling back some regulations and saying, industry, you go figure it out. And then on the other side, we're seeing a lot of new payment models come out from them, and especially from the Centers for Medicare and Medicaid Innovation, so CMMI. So talk a little bit about that and what you guys are seeing there.
So we're seeing a lot of a mix of mandatory versus voluntary, which is an important distinction with CMMI that we don't always talk about. You have the mandatory drug pricing models, so Globe and Guard. We have even now Trump RX, which isn't obviously CMMI, but another drug pricing, initiative there. And then we have the generous model and access for technology. They've got, I think there's a list of 8 or 9 of them now. They've gotten very creative. I give them props. Very creative with all of the acronyms and the names. But it's a lot of how can patients access the medication in an affordable way, and looking at even the kind of the longevity of these and doing 10-year payment models versus some ones that might be a little bit shorter, and then how those could be implemented on a wider scale.
That's great. And I think, some of them, when I think about it, fall right in squarely in our world, especially like the digital therapeutics and some of those. So it's been interesting to kind of see the shift, I think, in, their thinking and, how they're approaching that.
And I think the access model, for example, that's still, that's right out there and is technology and access to care. And then you have a lot of the rural health types of initiatives that are not necessarily payment models, but are just a priority that they are, that both Congress in appropriating the money for it and the administration and really getting it out the door is, it's a huge priority to get all of that out there and look at rural access as well.
Yeah, that rural health transformation I think is so important. And I know we kind of looked at it a little bit. There was, I think 11, 12, maybe more states that actually had pharmacists as part of that. I think each individual state had to submit, right, their different plans.
For their own plans and for their own funding, which I think is really a credit to pharmacies and pharmacists on, that's a huge access point of care for patients in rural America and outside of an urban setting. There's a pharmacy, in some places much closer than a primary care doctor or a specialist, and but that's the medical professional that people feel comfortable with and is there and accessible to them.
Yeah, definitely. I want to switch topics. Prior authorization, which is something we've been working very closely on.
Of course.
So obviously back in June, July, big White House announcement with all sorts of CEOs signing a pledge, right, that they would get to 80%, I think it was automation or something like that. We know on our side that we've had a standard for a long time and decided to kind of say, hey, we want to do some pledges as well.
Right.
What are you seeing in terms of kind of across all of the work you're doing in terms of prior auth, kind of where you think we're at? I mean, that seems like such a big hot button with the administration, with CMS, with ASDP, all of the government agencies. Just curious your take.
I think the administration, the agencies are treating this more as kind of a systemic issue at this point, and that's why we saw the pledges and 80% and this, a more aggressive type of timeline that they're going for. There's legislation, there's regulation, there's a lot of action on it. On the legislative side, they have the Ensuring Seniors Timely Access to Care Act, which is more on the medical side of things. It's a bill that has been introduced and has broad bipartisan support. There's the 2024 rule on prior authorization that was also on the medical side. And then on the drug side, there's conversations around reintroducing the Electronic Prior Authorization for All Drugs Act, which would carry that EPA mandate into the commercial market and into broaden what those markets look like. There's also a rule that is sitting at the Office of Management and Budget for a final review that is interoperability standards and prior authorization for drugs. So I don't see that activity lessening at any point in time. And it's been great that NCPDP has been kind of the convener for a lot of a place where people can come and kind of figure out how this looks moving forward and help CMS and the agencies kind of really drill down on that.
Yeah. I didn't realize there was a new act that might be legislative
It's
act.
not new. It would be new for this Congress.
Yeah.
It was introduced back in the 117th or 118th for the first time.
Oh, wow. Okay. The other thing I talked to Joel about, which was pending at the time, was the one for pharmacists to get paid.
Caps.
Yes.
Yes.
Thank you. I'm like, I know it was called something.
Yes.
Where's that now? Like, whatever happened with that?
It's still pending.
Okay.
I think there's been a lot of support around it for in the rural settings in different areas. It was in conversations to be included maybe in reconciliation and the first reconciliation bill, which turned into One Big Beautiful Bill Act. And I think it's still there as something that people are looking at, and there's some pretty there's a pretty broad swath of support behind it. but it's, there's the ECAPS bill it's pharmacist services and expanding what Medicare could pay pharmacists for. So things like vaccines, testing in certain scenarios, things like that. And it's still pending and hasn't been included in anything yet, but I think there's still some hope that will happen prior to the end of Congress.
That's great. Yeah, especially now that we're seeing funding for rural health, and it just seems like the time's right. So that would be great to see that. Yeah. So I know, we went through a little bit of a longer shutdown back in October, and then we went through a mini shutdown just a couple weeks ago. Yeah. But I know that the HHS, like the funding came through. What's in there that our members and listeners should be kind of paying attention to on that?
Yeah, I think to tee that up, on a broad scale, there was, I think, $116.6 billion for HHS broadly in that bill. Despite deep cuts that were proposed in the budget, those didn't end up coming to fruition. So CDC, NIH, ASTP, ONC, those agencies are generally flat funded for the most part, and a lot of the initiatives are as well. So some of the deep cuts that we were seeing and that folks were worried about didn't happen this time around. Not saying they couldn't in the future, but they didn't this time around. And there is things like the Universal Patient Identifier, Unique Patient Identifier, UPI. The ban is still there, the one that's been there for 20 years that we talk about every advocacy tour. But there's also language in there for patient matching and money that is specifically targeted for patient matching. I think there's $3 million for patient matching. The interoperability standards language that, again, we talk about, the traditional language was included, so there's still money in there for implementation standards, and that's still a priority. And a lot of the different tracking, tracing, kind of how a lot of that works is still funded at kind of the quote normal levels that we've seen.
Okay, that's good. I'm excited about the patient matching funding.
Yes,
Finally.
Everybody. And that would take us through September 30th, 2026.
Okay.
And then after that, hopefully we don't see another history's longest shutdown.
Right.
Like we did last year. And the appropriators seem pretty intent on making sure that this goes through regular order, that there is plenty of input and all of that, and that process is all starting now. They don't really get a break when in these particular cases. So that all starts now, and we should see language again in probably June.
Yeah, okay, all right.
Hopefully.
Yeah, good. All right, so as we wrap up, what's kind of the one or two key insights that our listeners and our audience should be thinking about around this policy landscape? Like we kind of talked about, there's a couple themes there. Things are moving faster. Any other insights that you may have?
Yeah, I think the access, affordability, technology, those those themes are ones that have emerged and are, I think, are going to stay the themes for through the next year, through midterm elections, which is the other thing that we have coming up at later this year, and throughout the next Congress. I think one piece of advice maybe is to tee up is this is an environment that rewards engagement. So be engaged, whether it be with your local pharmacy boards, or at the local level, or through NCPDP Advocacy, or just with your own members of Congress and so any of the administration officials you may come across that they're listening and they're moving quickly, and in order to do that, they need the right information.
Yeah, I love that advice, because I have noticed all the HHS officials are, making the conference circuits and, out there actually listening and talking to people. So,
in order, they can do their jobs the best when they have the best information. And thankfully, NCPDP is full of experts that can help them with that.
Yeah, absolutely. Well, Jen, great to have you on.
Thank you.
And always fun to work with you on these things, and excited to see what's coming this year.
Us too. Thank you.
Yeah.
That's a wrap on this episode of NCPDP Unscripted. Thanks for joining us as we explore the voices and ideas driving innovation in healthcare. If you'd like to be a guest on the show or have topic ideas you'd love to hear us cover, we want to hear from you. Until next time, stay curious, stay connected, and stay unscripted. Our podcast is proudly sponsored by Marks Productions.